Welcome to Nonprofit Stories, inspiring tales from Silicon Valley. We will explore the transformative work of nonprofit organizations and leaders who are changing our community by tackling some of the most pressing issues facing Silicon Valley. So without further ado, let's dive into this exciting conversation. Today, we welcome Thomas Bakewell, the Executive Director at Lupus Foundation of Northern California. Dedicated to serving an ethnically and economically diverse population and providing the broadest possible access to services, the Lupus Foundation offers programs designed to meet patients and their families' social and educational needs in English and Spanish, in person and online. Thank you to our sponsor, TradeMyHome.com, for their community commitment and for making this podcast possible. In the vast realm of health challenges, one stands out with its distinct female majority, lupus, a condition where a staggering 90% of those affected are women. Yet beyond the gender disparity lies a financial storm, with each patient shouldering an annual loss of $50,000 due to healthcare expenses and diminished productivity. But perhaps the most disturbing revelation: over half of Americans remain in the shadows, either completely unaware or possessing only a vague understanding of lupus. It's time to bring this to light.
Tom, welcome to the show.
Thank you, Shared. It's a privilege to be here.
Give us a brief history about your organization. Who do you serve, and how did it all begin?
Sure. Let's start with a quick summary that we are now celebrating our 45th year of continuous service as a nonprofit. We were founded in 1978. Jo DeWurst was our founder. She served as the first executive director for 31 years, and Jo herself was a lupus patient. Sadly, she passed away about a year ago, but it took about 6 years for her to get her lupus diagnosis, which even as of today is not uncommon to take that long to get a diagnosis. And when she received the diagnosis, her doctor told her, this is a disease that affects largely women, can be fatal, and don't know a whole lot more about it. And she found that to be very unsatisfactory. So she went to the Stanford University School of Medicine bookstore and bought the Stein and Day Encyclopedia of Medicine, which we still have in our offices today. And on page 283 is about 3 paragraphs dedicated to lupus. And it says, largely, it's a disease that affects women. It's an autoimmune disease. It's very complicated and very hard to diagnose and hard to treat. And with that as context, she said, that's not enough information. So she created an organization back in 1978. The Bay Area Lupus Foundation was what we were originally called. And the mission of that organization was to empower lupus patients, their loved ones, and their healthcare teams with the most current information available, and provide programs and services to support the lupus patients and their loved ones. And that is still our mission today.
What is lupus disease?
Lupus disease is an incredibly complicated autoimmune disease. And quite frankly, if when they find a cure for lupus, most autoimmune diseases will benefit from that cure. But it is a chronic multi-symptom disease that creates tissue and organ damage in varying levels, of course. But the organs and parts of the body that can be affected by this: heart, lungs, brain, nervous system, immune system, bones, eyes, skin. Oftentimes, the only outward symptom of lupus is a butterfly-shaped rash on someone's face, or very white fingers and toes. And it is a disease that affects women and women of color much more than men by a factor of 10x. And in the United States, the prevalence of lupus is between 40 to 150 cases per 100,000 people. So it's a fairly common disease in the United States and in Europe.
What is your personal passion behind serving the organization?
There's always a what and a why. So I'll start with the what. Given that what I've just said, that it is such a complex and pervasive disease, you don't need a whole lot more to motivate someone. However, for me, that motivation came about a year ago. It's funny, I spent my entire career in high tech, running IT organizations for some of Silicon Valley's top companies. And about 6 years ago, I went to work for a nonprofit company in Santa Cruz, California, running their IT organization. And about a year ago, my wife, who also runs a nonprofit, got an email from one of her volunteers who is on the board at the Lupus Foundation saying, hey, we're looking for a new ED. We've got a couple of years in the pandemic without one. Do you know any recruiter that specializes in the nonprofit world? And my wife said, no, but my husband does. So she sent me the job description, and I read the job description and said, I don't want to pass this on to a recruiter. I want to talk to them. I want the job.
Sure.
And my wife was, why? Why do you want that job? Well, pretty clear to me. My mom had lupus and passed away. My oldest daughter has lupus. And it is very common, actually, for lupus to skip a generation. And I've seen firsthand what it did to my mom and what it is currently doing to my daughter. And for me, there was no way I could not want this job. Right. So I convinced the board to hire somebody without any executive director experience, that I would work hard and do everything I could to make this organization successful. They believed it. They currently still believe it. Let's keep it that way. But that is the what and the why. And when you put those two together, I don't think of any more powerful motivation than to get out of bed every morning to help serve this organization than that.
Share with us a couple of success stories where your organization has played a crucial role in changing someone's life.
Sure. So there's a lot. We serve Northern California from the Sacramento area down through the Monterey counties. And so we have a very large area to cover. We are now virtual as well. So we do get patients from around the United States. But there's a couple that just jump out to me. Very different. One of which is the sister of one of our board members. Grew up in a family of 5. She very healthy. She started to develop some health conditions in college. She then took a trip with her family to Europe and realized that she was just exhausted. And she just attributed it to jet lag.
Sure.
And she also started to notice that her fingers were turning white. And again, just, okay, she's 20-something in Europe and having a good time and doesn't quite feel right. It kept getting worse and worse over time. When she got back to the United States, she had trouble getting out of bed. She had trouble moving. When she had her strength back, she went back to work. Her coworkers noticed that she was in not a very good position. They had an ERT, an emergency response team at her company. They measured her heart rate was over 200 beats per minute. They got her into a hospital where she had a stroke in the hospital, which is a common manifestation for lupus. Heart disease is another one. Her heart stopped several times, but it took a long time for her to get the diagnosis that this was lupus. And she was scared to death. And so she and her sister began doing a lot of research online, because nobody could give her a lot of information on it. So she was taking it about herself. And they found the Lupus Foundation of Northern California online and contacted us. And we worked with her to provide her with information on treatment, information on medications, paired her up with a buddy program, which is one of our services. We do virtual doctor office visits where she was able to talk to a physician. We do health conferences where she was able to participate to learn more. But more importantly, we provided support. So we listened to her when she needed just a set of ears. And she's been an active participant now for 25 years in the organization. And she's been one of our faces of lupus for us.
Sure.
Wonderful woman to have helping us. And it's very, very visible what she does for us. And so it's a really easy example. But when I think about other things that we do and other success stories, if you will, I was in my office. We have a very small office in San Jose, and I was in my office, and one of our other staff members answers the phone. She was on the phone for 45 minutes. She was talking to a lady in Minnesota who found us on the internet, and her 13-year-old daughter was diagnosed with lupus. And we don't have services in Minnesota, but everything's virtual anyways. We provide her with all of that. But she really didn't want those services. She just wanted somebody to hear how painful this was for her to see her child go through this. For 45 minutes, our staff member talked to her, didn't say a whole lot, just listened, got off the phone in tears. And that is why we exist. It's the patient-centric perspective that we bring to this. It's not a foundation for anything larger than dealing with patients. And it's those types of examples that are opposite ends of the spectrum. We get everything in between, but those are the two that just jump out as being, we help somebody from literally a hospital room to a mom who is her daughter just diagnosed with lupus.
How do you cater to the unique challenges of women?
Yeah, I mentioned a minute ago that it's 10x and largely women of color. And so there's multiple ways to do this that we have adopted, one of which, and this is in no particular order, but one of which is diversity at our board. So a large percentage of our board are female and female of color. And I think that's really important for us to understand that perspective. And we have on our board, many of our board members, either they themselves or family members have lupus. So we have firsthand knowledge of what they're going through. For us, we build support groups to cater to women and their families. And that is everything from a men's support group, because there's not great communication, to an adolescent support group for children watching their parents go through. But the majority, and those are just two of our 18 support groups. The larger percentage of them are all women based and women led.
Sure.
Worried about the dilemma of selling first or buying first? TradeMyHome.com, powered by Your Home Sold Guaranteed Realty, has the solution. With our guaranteed 24-hour cash offers, you won't risk owning two homes or being homeless. You can buy first and sell later. Are you upgrading or downgrading in the next 3 to 6 months? Text PAIR to 408-740-7400 for a free and no-obligation professional equity appraisal report. Exclusively for Nonprofit Stories podcast viewers. For more information, visit TradeMyHome.com or call 408-740-7400. Remember, at TradeMyHome.com, your home is sold guaranteed or we'll buy it. For the next episode of Nonprofit Stories, featuring Dee Kiso, an internationally recognized speaker, coach, advisor, author, and auctioneer in Silicon Valley.
I'm actually a fifth-generation Santa Clara Valley native. I have 3 children, and they're all young adults now, all educated here as well.
Her mission is to empower fundraisers, entrepreneurs, volunteers, and organizational leaders with the transformative skills and mindset necessary for successful fundraising.
Doing things for the community. And so how it got started was I also tend to love sales. And so I was...
Check out our next full episode on Wednesday at 5 o'clock Pacific and 8 o'clock Eastern on YouTube and Apple Podcast.
What other programs do you run to help support those in need?
So we have a variety of programs. We've got the first in the nation Lupus Buddy program, and that pairs up an existing lupus patient with a newly diagnosed lupus patient. And that can either be as a buddy or a friend or a mentor-mentee, depending upon the needs of the patient. We have health conferences that we put on 6 to 8 a year. Our focus is both in English and Spanish. Our focus is the healthcare. So we have doctors. One of the last ones we did was the women's cardiac center chair from Johns Hopkins the Mayo Clinic, led a conversation on heart disease and lupus. Mm-hmm. We have pharmacist programs that talk about drug interactions and how to communicate those to your physicians. We have virtual doctor office visits that occur one Saturday a month, where patients can talk to a physician about what's going on in their lives. We have the 18 support groups that I mentioned earlier. So it's all programs and services, as well as library of video and digitally printed material for lupus.
How does your buddy program work?
The buddy program is fantastic. So you do it a couple of different ways. You can do it all online, anonymously, or you can call our office. Mm-hmm. So registering online says, hey, I've just been diagnosed, or my child or my loved one has just been diagnosed. Really like to be able to talk to somebody that has this. And it can be all online. We don't say you have to meet. There's no personal information that's given out. It's whatever you're comfortable with. So we provide the training for the mentor or the buddy leader, and we make it available to anyone across the United States.
What new treatments and technologies make you excited?
The new treatments are all clinically they're medicine, essentially, and what we're seeing is the shift from corticosteroids to more targeted medications for autoimmune disease. We're seeing that happen at multiple pharmaceutical companies that are all striving to arrive at that one medication that's going to alleviate the symptoms, and then be able to get to the root of the problem and find that cure. We think there's no one is saying there's going to be a cure in the next 5 years or 10 years, but the new medications are coming out at an increased rate of speed. There's about 4 or 5 coming on the market in the next 3 to 6 months that we think have an awful lot of promise. In fact, we are presenting a program through 2 board-certified pharmacists to talk about those that will drive behavior at the patient level with their healthcare teams. And why that's so important is that they need to be able to say, look, here's my symptoms. This is what the new treatments are targeting. I want to be a part of that. That's the clinical side. There is another entirely different component to this, and that is that 80% of clinical trials fail because of a lack of participation. And so we're looking at partnering with firms that anomalize patient data, and the patients still own it, but share that data with the appropriate targeted pharmaceutical to increase the efficacy of the test. So if we can get a more robust size of participants, the trials go faster. If the trials go faster, the medication gets to the market sooner.
Right.
There's also the potential for patients to have financial benefit for that, because there is pharmaceuticals are looking for patients. They can't find them. So we're working with a couple of startups to try to get them to bridge that gap. So we think that there is a huge value in the sharing of that data, and huge value in the awareness of what's coming out. And we're trying to put those two together for the patients that we serve.
Do patients run into any issues with insurance companies?
Insurance and financial services in general are a great component of our society, a needed component of our society.
Right.
The majority of them are for-profit, and so they are on a fiscal or a calendar year basis, And diagnosis can take multiple years.
Right.
And so keeping that cycle current is extraordinarily difficult. And one of the biggest challenges that we see is the reset. We see where insurance companies are saying, okay, you've spent your maximum on this. We can no longer provide this care. And that's a problem that we're seeing. So what we're trying to do is work with insurance companies and healthcare providers with their patient groups to ensure that there's a continuous communication. Because once you have that dialogue and once you start the dialogue with an insurance company, they tend to keep that file open longer. And that's what we're trying to help them accomplish.
And what role do volunteers play in the success of your organization?
So the Lupus Foundation, it's a great word. Foundation sounds like it's a very large organization. We have one full-time employee. She's been with us for 16 years. She's fantastic. We have a half-time consultant who does most of our technology. And then we've got me, which is a half-time executive director.
Okay.
And we've got 18 support groups through Northern California. Every one of those is a volunteer. We have 2 major fundraisers a year, an Outrun Lupus 5K walk and run that we've just held this past summer, and a celebration dinner that we hold every year. Those are all managed. We manage those logistically, but all the volunteers, both in preparation and day of event, really, we couldn't do it without them. We provide training for our volunteers. We provide them an environment with which to work. And we literally cannot function without them. Our board is also a very strong component of that. Our board is extraordinarily active, and we also need that. Yes, you always want a board to be governance focused. In a nonprofit world, we need governance, we need financial, and we need operational help. And so they do know when to pull each one of those levers.
Right.
But the volunteers for us they're just critical. One of the very first things that I did when I joined the organization was give me a list of the volunteers. Let me go introduce myself. Let me tell them why what they do is so important. And I shared my story about my mom and my daughter. And it's that connection with them, because the majority of our volunteers also have lupus. And that is wonderful for them to be able to share. It's also difficult because you can never predict when there's going to be a flare-up. So we have to be extraordinarily sensitive to that, and also overstaff,
right? Because
sometimes they just can't help.
What is one myth about your organization and the work which you do?
I think the biggest myth, I just used the word foundation. I think the biggest myth is, wow, you're a foundation, you must have lots of money.
Yeah.
No, we don't. We, as a percent of what we raise in an annual basis, that percentage is so small that goes to overhead. Everything goes to programs and services.
Because it's mostly volunteer run.
Mostly volunteer run, and we're not here to make money. We're here for the patients. Everything that we do is through the lens of the patient. We are a patient-centric organization. And so for us to say, yeah, we're a foundation, people think, wow, that's pretty cool. Yes, it is cool, but it's not cool for the reason you think it is. And the other one is, people think, oh, you must be a research organization. Well, yes, we do try to help with research. We do what we can to help, but we are not a research organization. We are, as I said, focused solely on the patient.
And what one advice will you give to the community you serve?
Stay close. Now, what that's a quick one. What is that? What do I mean by that? Well, stay close to your healthcare team. Almost every lupus patient has an interdisciplinary team of healthcare providers. They're all busy. They all have a lot of patients. Stay close with them. One of the ways you can do that is journaling. So as you have a flare-up, as your mood changes, as your medication changes, as your symptoms change, write that journal, share that journal with your healthcare providers. It's incredibly important. Stay close to your loved ones. Listen to what they have to say about what you're going through. Stay close to your mental and physical health. Give yourself time to recover. Give yourself time to feel better and to enjoy life when you can. One of the services that we provide is low-impact workouts, online low-impact workouts.
I see.
For lupus patients that may not be able to raise their arms above their head. Pay attention to that. Stay close to how you're feeling. Stay close to us. We offer a lot of services. So if you had to do the takeaway, it would be stay close.
Well, Tom, it's been such a pleasure to speak with you today. Keep up the great work and let's stay in touch.
Thank you very much. It was my pleasure.
Thank you for listening to the podcast and acknowledging the impactful work of nonprofits in Silicon Valley. Please subscribe and share this episode with a friend. Thank you to our sponsor, TradeMyHome.com, for their community commitment and for making this podcast possible. Until next time, remember to support local nonprofits.